My name is Marie Currie, and I'm an artist. Been a sculptor for about 10 years and developed a really, really bad cough 4 years ago and couldn't seem to get this cough under control. Make a long story bearable with that is my primary care physician sent me to a pulmonologist, and after a battery of tests, they said I had pulmonary fibrosis and gave me 2 to 5 years. That was quite shocking, but the one thing that I do want to say is I'm thankful to God that I had it, because I was getting MRIs about every 3 months to look at this progression, right, of this fibrosis. And that is when they saw this tiny little glow on my left side. And that is when he brought up Dr. Rehman, who had this breakthrough technology where they would go in, take a biopsy, and then immediately freeze the tumor. And that for me was, I said, set me up an appointment. And I had another MRI, and at that point, the tumor had grown an entire centimeter. It was time to get it done. Met with Dr. Rehman, and here we are.
This is a case of a 64-year-old lady who presented to us with enlarging lung nodule in the setting of combined pulmonary fibrosis and emphysema. She came to us to get evaluated for potential lung cryoablation for treatment of the enlarging lung nodule. This is her imaging. She came in with an enlarging left lower lobe pulmonary nodule in the setting of significant pulmonary emphysema as well as fibrosis demonstrated by honeycombing at the lung bases. This nodule demonstrated spiculated morphology and interval growth on 2 scans previously done at 6 and 1 year. On the PET scan, this nodule demonstrated increased FDG uptake, highly concerning for malignancy. She was offered the option of combined biopsy and ablation, which she wanted to pursue. And she was taken to the hospital in which a biopsy was performed. As you can see, the introducer needle is being advanced into the nodule, and biopsy specimens were taken, which came back consistent with squamous cell carcinoma. Following the biopsy, in the same session, cryoablation probes were advanced into the tumor under CT guidance. You can see an ice ball develop surrounding the tumor in real time, and cryoablation was performed. She did very well from the procedure. She was followed up with repeat PET-CT examination at 6-month and 1-year follow-up intervals, which demonstrated a residual scar in the region of treatment without any abnormal uptake or activity. These images clearly demonstrate FDG avid nodule in the left lower lobe, which lost activity post-ablation on the follow-up PET-CT imaging. She has been cancer-free post-ablation now and has been doing clinically well.
I cannot stress enough to people that are in my situation that they need to know that this option is available for them. And I couldn't be doing better. That's just obliterated. The thing is history. I owe that procedure and his expertise my life. Absolutely my life. And I don't believe that I would be here long for my grandson if it wasn't for how blessed I was that this procedure was available at the time it was. And boy, do I love being a grandma. I feel young again, you know, when I'm around that little boy. You know, it's an amazing thing, and I'm so grateful that I'm here for it, you know. For me, it's the radiologist that saved my life. So I would say thank you to everybody that does what they do and saves so many lives. And I appreciate more than they would ever know. Than they would ever know.